eyes are squarely on the future. We are currently working on the expansion of space for more programming through the Corner 2. We call it the Corner 2 expansion. And we are also working on advancing the Corner's model of service, a model that can easily be scaled up to larger organizational systems to respond quickly to the needs of our communities.
I do remember visiting the Corner with Ravi and Nalini several years ago and being so impressed with how residents, providers, and partners came together to develop this unique and collaborative hub. It was beyond just delivering health or social services or municipal services, but the ability to bring people together to serve the needs of the residents in a holistic way, leveraging dedicated space in the community. Health Access St. Jamestown brings integrated health services to residents in the community at the Corner. And this may seem like something normal, but I have to tell you, it was actually quite unique for its time. Having over 15 organizations coming together to connect people to services quickly and effectively is actually more difficult than one might expect. But that is exactly what happened due to some incredible leadership by several people here today.
The Corner stepped in with income supports, food security, wraparound services to support testing and vaccination in St. Jamestown, all with heart and grace and love. And just hearing how much that felt like support to this team in a tough time was just a testament to what this means, this kind of partnership, this collaboration, and what it means to the community and the neighborhood. We rely on partners like you to achieve safe, effective, and enjoyable experiences for patients, families, and communities. Strong partnership is, of course, part of all the work that you do and your achievements with more than 30 partners that St. Jamestown providers in the St. Jamestown Providers Network. This past year alone, Health Access St. Jamestown registered 1,600 new patients, made over 220 referrals, and provided over 1,300 on-site appointments. The Health Access model has proved so successful, it's been replicated in the city in Thorncliffe Park and Taylor Massey. During the pandemic, Health Access St. Jamestown has been a pioneer in community-based testing, using the Corner as a much-needed access point for COVID testing in the neighborhood. You ensured that testing was just the starting point. Wraparound supports, including food security, isolation supports, and connections to primary care were critical to meeting the true needs of this neighborhood. The Corner also operated a COVID vaccine clinic with culturally safe, low-barrier access.
There's very few jobs where I can say that I'm excited to really show up every day, and there's very few jobs where I could say I could serve community in the grassroots way that we do. St. Jamestown is a very unique community. When we come to the Corner every day at work and we're meeting people where they are, we're also meeting very, very challenging systems and obstacles, which we have to work collaboratively to overcome. So we get to see different culturally relevant small businesses, different groups that residents are creating both organically and at the Corner, and different cultural exchanges happening all the time in places like the St. Jamestown Market. I think it's really, really important to come into these spaces and really soak up that experience as a totality. We can't just look at it through the lens of service providers. We have to look at it through the lens as community members. And I think that's why it's so important, the Corner's motto, which is owned by nobody and owned by everybody, because it really speaks to the spirit of valuing and embracing the diversity not only of languages, ethnic groups, etc., but also of experiences, of lived realities, and yes, of challenges and of structural barriers faced. But together, as a community, as a non-hierarchical structure, as a collective of folks who are committed to doing something different in terms of how we approach social work, how we approach community organizing, how we approach grassroots engagement, as that collective, having that commitment to doing something differently, I think has made all the difference here at the Corner.
So the beginning of the Corner really was a grassroots movement, a collection of residents, tenants from Toronto Community Housing and service providers who basically created what they wanted in the way of delivering services. And what they said over and over again is they wanted space for their own communities and groups to be able to meet and plan and contribute to the gaps in the community. And they also wanted more formal services related to some perhaps legal consultations, immigrant support, newcomer support, LGBTQ issues in St. Jamestown. They wanted support, health, social services, and probably less formal health, although that's changed over time, but really looking at health promotion. What has been really key to the success of the corner is that it provides a welcoming space. It provides a safe space for people to come in and sometimes not even know exactly what they wanted or needed, but they could come and check us out. And it was a place where people have said repeatedly over and over again, they felt like they belonged. And that's been really important to the success of the corner.
I work for Sherborne Health, which is one of the partner organizations of the corner. We really work as a team, and when I say it, I mean it in every sense of the word. And the team is just not management or staff or ambassadors or volunteers. It's all of us together as well as the community. So, when we look at programming at the corner, it is always based on community consultations. We have an annual spring gathering event which happens once a year, where we have very extensive community consultations on different things that impact the community, and out of that comes the programming. So the programming is directly involved by the community and what they say. It's based on what our staff also hear from community members. So recently, based on these factors, we had a huge food security initiative during the pandemic. We've also had a safety initiative just to make St. Jamestown a safer neighborhood where all of us work together and contribute towards the safety of the neighborhood. And I've been lucky to be associated with the corner since 2013. We are very excited about the 10th anniversary and what we have achieved to date, how we have worked with the neighborhood, and where we'll be going next. Thank you.